This agenda looks obnoxiously long, but if you look at it, it really isn't, because it's a lot of questions to get us to kind of talk and have a robust conversation. I would like to do a bit of a roll call. It sounds so old school, but just so that we can catalog who is attending this call. And heads up, this is a recorded meeting, and the link will be sent out to all of you once my IT uploads it onto our YouTube channel. So I'll go first. And then Cindy, if you could introduce yourself, and then Connie, and then it's open floor. My name is Hcaa, and I run the CSBG and FRC programs and human trafficking for the state of Nevada. And all of you should know me very well by now. Cindy.
Hi, I'm Cindy Jonkis. I'm the administrative assistant for the grants management unit.
Thank you. And this is Connie Lucido, also with the grants management unit. It's good to see you all joining us this morning. Thank you. Thank you. Tisa, do you want to start by calling each CAA?
Yeah. Oh my gosh. Let me pull up my, yes, let's do it that way. Let me pull up my list, because there's 12 of you and I want to make sure I don't miss anyone. Anyone from Churchill?
No Churchill?
No Churchill. Although they did say that Shannon said she couldn't make it today. She has a conflicting program. Anyone from Community Chest?
Yes, I'm here, Tisa and Connie. Good morning. It's Eric.
Hey,
Eric.
Hey there. Good morning.
Here from Lyon County.
Someone with noise in the background, please mute.
Who's here from Lyon County? Okay. All right. Frontier, Janine's here from Frontier Community Action Agency. Who is here from Consolidated Agencies of Human Services? Okay. Carson City Health and Human Services, Mary Jane, I saw you.
Yes, I am here. Good morning, everybody.
Am I going to see your pretty face?
No, I'm going to turn it off.
Oh. And then from Economic Opportunity Board, we have Lawrence.
Hey guys, how's it going?
Good morning. How are you?
It's hot.
I'm going to be there tomorrow. I'm very nervous.
They implemented a mask mandate.
Yep, re-implemented the mask mandate for employees.
Wait,
but not for the general public.
Oh, bummer.
So essentially it was a mandate to status quo.
And then we have two folks from Douglas County Social Services. Do you want to introduce yourself?
I'm Jody Qualls. I'm the Administrative Services Manager. And
I'm Karen Witt. I'm the Social Services Manager.
The new manager.
Yes.
Thank you. And then who's here from Lincoln County? Okay. And then, am I echoing?
You were.
And then from Nye County, we have Corinne and Jenny. If you guys want to say hi and introduce yourselves.
Hi, this is Corinne Smith with Nye County Health and Human Services Director.
Good morning, Jenny Martin with Nye County Health and Human Services Program Supervisor.
And then from Community Services Agency, we have Leslie.
Good morning, everyone.
Good morning, Leslie.
And then who do we have from White Pine County? Okay. Cindy, I will share with you the contacts after the call. Okay, well, thank you. Oh, wait, Lindsay, do we have you on the call?
Yeah, sorry, I was a few minutes late. I was having trouble logging in on my computer. So you just get my voice today, and not my.
And Lindsay is from Nevada Community Action Association. Is there anyone else I've missed if you're calling in?
This is Janine Robinson. Elaine Knight's also on the call. She had to step away from her desk real quick, but she will be on the call as well.
Great, thank you. Okay, guys, so first item down. Connie, please feel free to hop in as I go through, soldier through. The innovative idea is to utilize discretionary amounts. So as you all may or may not know, we have $90,958 of discretionary dollars set aside to use for innovative programs. And in last week's board meeting, I believe it was Mary Jane and Shayla who floated the idea of doing a trauma-informed training for all CAAs. What do you guys feel about that? And Lindsay, please feel free to hop in and say whatever you want.
Yeah, I was just going to add, Mary Jane did send over some contact information for a consultant. So I've reached out to them, and then Shayla and I had a good conversation on Friday when I was there visiting her, and she shared some more resources. So I'm in the middle of just kind of getting some numbers together and an idea of what that might look like if we move forward with that. It seemed like we had a lot of good feedback last Wednesday during the board meeting of different agencies that wanted to participate in that. But I am going to send out a final doodle poll. It's in the middle. It's in the email I'm in the middle of writing, just to make sure that we have a good percentage of agencies that would like to spend that money on that. But I'm open to discussion if anybody has any other ideas as well.
This is Connie. I think that's a great idea. Tisa, I would also encourage you to reach out. I can give you some contacts at DPBH. Potentially, we may be able to do this without a cost. So that would be nice, right?
Wait, so when you say without cost, like have somebody from DPBH train them?
Yeah, some clinical providers may have the ability to provide that training. It's spearheaded from DPBH and some of their subrecipients.
So if that's without cost, like then we can just pay for the CAAs to attend if it's an in-person meeting. Okay. Right. And so they would be. Go ahead. I'm sorry. Who wanted to say something?
Yeah, no, hey, Tisa, this is Eric. Hey, we had talked about this a little bit at the NCAA meeting in terms of if this were more of a clinical kind of a training. I think Connie's totally right. We could find somebody within the state who could probably do that. What I heard from Mary Jane and Shayla was a new wrinkle to this, which is somebody who's able to do sort of an organizational analysis and deep dive of kind of how you would have your office systems set up. For example, your front office, what that might look like if it were trauma informed, how the staff would greet and welcome staff who are coming through, so that your entire organization, top to bottom, not just sort of your clinical staff and your case managers, but you have a 100% trauma sensitive organization from the minute that person opens the door and walks in.
So thank you for that explanation, Eric. So then what you would, better description of the conversation is that you would like a consultant to go into each CAA and perform a workflow analysis to determine that?
I don't want to speak for Mary Jane or Shayla, but I was thinking at the minimum, somebody who can provide sort of a template for what that would look like if we were going to do our own diagnosis and kind of what level of training we might have to have for each of our, and how we would look at our organizations when we're trying to do this. Maybe it is a self-inventory, and maybe, I don't know, maybe we do need somebody who's able to come in and say, oh, you know what, you may not even realize it, but this is a big trigger right here.
So Shayla is on the call too. So Mary Jane and Shayla, if you wanted to break it down further.
Well, this is Mary Jane. I'll just add that we did have a consultant, but we had a consultant come to our community and, you know, not just our agency, but our community on how we can, or what we need to do to be a trauma-informed community. It was very enlightening. And I think that, and even a couple of years ago when we were putting together our RPIC training stuff, I was trying to put, you know, just, and that static isn't mine, but just putting together some trainings for the CAA on what is trauma informed. What all does that mean? What are all those pieces? Because actually just coming into our agency is only a very small piece of it. It's that whole community that needs to see that change and acknowledge trauma. So you know, and maybe it would be very, very expensive to have them come and consult each community action agency. But even if we could get some trauma-informed training on what does that mean, and how do we start transforming? So
Perfect. Thank you guys.
And I'm thinking if all the CAAs have trauma-informed training and they implement that, that opens the doorway for us to pursue other grants that are based on trauma-informed.
This is Shayla. I would just want to add that I think Eric pretty much hit the nail on the head in regards to somebody that could just provide that training to agency directors or their upper level staff as far as how we can do that 360 view for at least just our agency. I love the concept of what Mary Jane was sharing as far as a community. And I think the CAAs would be the best agencies to spearhead that in their communities to getting to that next step. But I think we have to start somewhere. I do think it also includes trauma-informed training for our direct service staff, but I think that those two perspectives look different in regards to how you provide trauma-informed direct services and then how you create a trauma-informed organization. I think that those are two different opportunities.
Absolutely. Lawrence?
So I know that the National Partnership has a ton of trauma-informed training. Are we looking at coordinating something through them so that we're not different from what they provide, or is this an independent effort?
Well, if there are trainings that I can find for NESCAP, and I will grab those and share those links for you if they're recorded, or I can engage. We do have a training agenda item. I can add that to something I could talk to NESCAP about. Or
and yeah, because I know Tiffany Marley does quite a bit of that at the partnership level.
Okay, that's good. Let me just add that.
You know, this is Connie. One of the things, we've had quite a few of the one-on-one calls with many of you that are on the call today. And one of the things that we've sort of heard repetitively, not necessarily in the exact same words, but that sometimes folks are not aware of the services or the things that are provided by each of your organizations or by a community action agency. One of the things that we wanted to float by the group as we consider ways to expend the discretionary dollars is whether or not you folks thought it would be beneficial to bring in a marketing campaign or something similar that may advertise or campaign on behalf of the Community Action Network as a whole, and be able to point them towards a link that could find their community action agency in their community. So I don't know if that's something that the group may like, but I wanted to get maybe some feedback on that.
So like a communication consultant that will outline a strategy for all CAAs for outreach.
Yeah, and one of the things I brought up too, and Connie, I don't know if you remember this, is also to help us with NCAA as well. So all of that encompassing and included in that will help us throughout that, because I mean, it's a challenge. The biggest opportunity we have is, why aren't we the best anti-poverty and the only anti-poverty in the state? And so I'm a huge fan of that, because I think that is the advocacy piece that we're missing.
So then maybe direct the campaign might direct to the NCAA website and then be able to provide some maybe some greater information from there.
Well, they've recently revamped their website and it's looking really good. Lindsay, are you not in touch with some communication folks?
I am. So first of all, I absolutely love this idea. I think that we need to get more awareness out there. I am talking with the communications team over at CAA, and they've offered to help a little bit with our social media. And they're just doing that with extra time that they have. So, you know, they're not really able to give us 100% of their time and attention, but, you know, they've definitely offered to help share some of their social media posts and to help post on, you know, our Facebook, our LinkedIn, Instagram, Twitter, all of which we are just right now in the middle of reopening. And I think having a communications consultant to kind of take a deeper dive and look into some of this and help us create a plan moving forward would be extremely helpful. I really like that idea.
Okay, so some good ideas. Also keep in mind, like, we have these discretionary dollars and we'll have some more with your FY22 base awards. So essentially we can do both of these projects if that is what you all want to do.
I also wanted to add one more thing. It would be really nice to use some of these funds, and I know we talked about it briefly last Wednesday, but to keep the iPads live. So currently we're spending about $1,500 a month on the iPads. And, you know, I don't want them to all turn off at the end of September. So if we could potentially use some of those funds, about $18,000 towards the iPads, that would be fantastic, if
and
everybody
then
agrees.
You can also put that for continuation, that dollars in for your subaward that comes out of the NCAA subaward that comes out of the base.
Okay, sounds good.
So we can talk offline to make sure there's no gaps in service with that.
Perfect, wonderful, that's important, thank you.
Okay, guys, so great ideas. Is there anything else anyone else wants to toss out about another possible idea on how to spend these discretionary dollars?
Tisa, I also sent you an email, and I apologize to the group that I wasn't at the NCAA meeting, so I didn't get an opportunity. But I've been really interested in kind of that 2-gen approach and looking at how to really start that process. I've actually had conversations with NCAP on it as well, but I want to take it slow. And so I don't know if that's something that the group is interested in or not. Primarily looking at least starting with, how can I do centralized intake? Unfortunately, internally, and I don't know if you all have the same issue, but I have to, and it's granted it's a soft handoff, but I'd rather not do a handoff at all if an individual family is eligible for all of our services that we happen to have applications for, that one individual can take care of that individual family. So that's the unfortunate thing is those grants that are out there, they want you to do the whole thing, and I can't do that. And my big organization, it'll crack, and I know that because I've talked to other community action agencies that have done that. And unfortunately, that kind of huge change is disruptive, and after the pandemic, I don't want to have that kind of disruption again in my organization. So I really wanted to take a methodical approach to that, and there's not grants available for such that methodical approach, or at least those baby steps, if you will.
So Leslie, this might be so ignorant, but can you explain what you mean by a 2-gen approach?
Sorry, it's actually probably more of holistic family, whole family approach is what I was actually looking at.
Mm-hmm.
Which would then hit the 2 gen, which is truly that working whole family, if you will, and certainly grandparents and everyone in between, because we do have a lot of grandparents that are taking care of kiddos, especially in Washoe County. So I think it's a great concept, and I know those community action agencies that have done it are very satisfied. But again, it's a very rocky change because it's huge. It's huge for any organization.
So you're envisioning hiring a consultant that would come in, provide a training, and then kind of look at each CAA and provide individual training on how you can approach and implement that holistic framework. Okay.
At least from the start to the end in a more segmented way, if you will. That's less disruptive. There's got to be some out there. I haven't looked yet because again, I'm taking this very, very cautiously, again, just because the pandemic has created such a ripple effect in my organization in terms of turnover. So
how do you guys feel about that? Mary Jane, I see you're ready to talk.
Yeah. I just want to caution everybody, and we have a lot of new people on this committee or this association and stuff like that, but I do want to caution. I was only able to attend one time David Bradley's conference in Washington, D.C., but the biggest thing about CSBG that was appealing to our senators and congressmen is that this is one stream of funding that gets down to the people that need it. And it doesn't get hung up on administrative things and stuff like that. I agree. We have not had good trainings in the last couple of years with this association. COVID, turnovers, things like that. And then even prior to that, any trainings we had was given by the eLogic people, like camp and stuff like that. So it's very, very appealing to be able to offer this group those types of trainings, and I'm all in support of that. But again, I want to be cautious. The discretionary monies used to get down to the agencies, and then which meant it got to the people, the direct service of our low income. And that was what was appealing to the congressman. So we don't want to drift too far away from that, in my opinion.
Are you talking about the one-off projects, like the local programs that were funded from this discretionary funds last year? I believe 3 of them were funded last year.
Well, yeah, but even prior to that, every agency had a discretionary fund as well. And then what happened with that, Hcaa, is that we as agencies were really getting frustrated with eLogic because out of our discretionary grants, we were having to pay eLogic. And so the state kind of drifted away from there. So, if we're not paying them, we won't complain about paying them. And so that's when the state started holding back some of that discretionary so that they could pay camp directly and things like that. So,
thank you for that, Mary Jane.
Yeah. So
was that, just wanted to get an idea of the timeline. Was that prior to the commitment to pay for half of your executive director also?
Yes.
Okay.
Yes, this was toward the end of the years of Gary.
Okay.
Leslie? Yeah, Hcaa, and I appreciate you saying that, Mary Jane. I came on and there was 3 projects that were funded at that time. And so I appreciate having a little bit more history because I'm not a fan of that. I'm not a fan of funding 3 agencies. And I don't know that makes the impact as great. But from your perspective, if we all received a little bit of pot of money, I suppose that makes a bigger difference. I look at it from the perspective of how can we make us all better, and if we can, if there isn't any, I think the innovative projects are a great a great suggestion, because obviously that is what David's focus is how do we make more innovation in CSBG? And I think that's the right perspective. But the challenge is then we're competing against each other and or trying to come up with small programming that doesn't necessarily make that large of an impact as far as I'm concerned. But that's up to us to make that impact. And I agree with you, Mary Jane, that if we all have that opportunity, I think that's up to us. But I also think that if we can use some of these funds to make us better, I think that would also be a huge impact to, and I would have no problem with telling Masto or Rosen or Amadei any of that, because it made us better. Does that make sense? So I think you're right. We have to be cautious to make sure that we are using it the right way.
This is great. Thank you, Leslie and Mary Jane. So I feel like these are conversations that needs to be had at the board meeting so that we can all kind of like come to a consensus. But this is really great. Connie, are you taking like super notes? Okay.
Yeah, what I think these are great ideas, and I would encourage more if we have the time to do that, or if there's something that maybe we don't, maybe you think of later this afternoon, because some of these questions are just very, these are new, you hadn't seen them before or been asked before. So if you think of other things, what I'm thinking we'll do is maybe just send a poll out and ask each CAA to rank the ideas, and then we can go from there.
Yeah.
Do the consensus.
Is that okay with everyone? Y'all can just shake your head. Leslie, you're not doing anything. Okay.
How about anybody that's just on the phone?
Lindsay, does that sound good?
That sounds wonderful. Yes, I agree completely. Let's move forward with the poll.
Okay, so as I move on, annual report. So as I've mentioned this before, the state will be providing annual report feedback every year. So I am reviewing your CARES modules right now. Once I submit it next week, I have drafted some notes. Connie and I will sit together, kind of review each module, like so the regular and the CSBG, and then provide a memo with our feedback, kind of like cheerleading you on great stuff, and kind of if we have questions about certain numbers and stuff. So it's going to be a very, it's not going to be one-way communication, it'll be two-way communication, but I think that's really important to close the loop when you submit modules to us, reporting to us. And because I'm on an annual report and my mind is running in 8 different directions, I will be in touch with NASCAP to talk about providing a webinar for you all before the annual reports are due next year, in terms of like showcasing each of the modules and each of the tabs, like how it's supposed to be filled out, why we're collecting that information, just as a refresher course for many of you and for your staff who's actually filling out those modules. I had asked all of you guys in my one-to-one, and this seems to be like a training that a lot of people would appreciate. So that is in the works. And, oh yes, Lawrence raised a really good point last week at the board meeting in terms of, so the plan is for FY21 reporting, and this doesn't affect Leslie, because Leslie, CSA will be kind of doing their own reporting. They'll have to do a bit of manual reporting. But for most of you, eLogic will be doing will be pulling the data for the module. So in my head, this is how the process will look like. And feel free to correct me or tell me if you know of a better process. When the modules are released, I will send them to each CAA on individual email and copy eLogic. eLogic will then, given the specific time frame, pull the report for those modules, and they will send it to the CAAs first. You guys will look at the data and make sure that those numbers look right. And if you are satisfied, each CAA will submit the modules to me for reporting. So I will not be accepting reporting like modules from eLogic directly. It will have to come from each of the CAA. Is that okay? Does that sound okay?
So I have a question regarding that. If eLogic is going to be generating the numbers and entering those into the spreadsheets, do we have a mechanism currently in eLogic where we can preview that before they do their entry? Because I'd like to be able to keep track of, I need some kind of secondary mechanism where I can check their data and what's being generated.
So what if eLogic pulls the data and then gives it to you and you guys fill out the modules?
Maybe I'm wrong, Lawrence, but I think what you're saying is that, Tisa, from me, in my perspective, and I know I'm a little bit an anomaly, but I'd want to see it more than just that annual, because it's going to kind of hard. Is that what you're thinking, Lawrence? Because I at least see it quarterly or something like that, because it'll be hard to go back that total year.
But you should already be doing that, right? Pulling quarterly, monthly reports on your end.
There's the kicker.
Why are you not?
I need a report that if I'm going to be submitting data on a regular basis, I need to be able to track that regularly throughout the year. And I need a report that exactly shows me what my performance is like on a monthly basis that I can review periodically so that I'm ready when the annual report is to be submitted, so that I have a track record to be able to say, all right, I know what I've been doing over the months. These numbers look correct. What eLogic is providing in the spreadsheet is correct. It's okay for me to submit.
So isn't that the purpose of the client diagnostic report, which is customizable?
But the client diagnostic report consolidates multiple areas of information that may or may not be recorded the same at each agency.
So you wanted a report that you can compare across agencies?
Well, it needs to be consistent if we're going to submit it as a state, right?
But then how
I would like a report across agencies. I think that would be fantastic if we're all reporting on the same indicators. We need that, absolutely.
But then how would that work with CSA, given CSA is an anomaly right now in terms of reporting, Leslie?
I'm hoping that that's going to be done, Tisa. I'm hoping he's going to get that taken care of. The only thing I'm going to have to do is my outcomes, but the reports will still be the same.
Yeah, we need to make sure that it's consistent.
Okay. So this report, and I'm just trying to visualize, it would have the same data elements that we submit to OCS. So a module four, essentially.
Yes.
And it has to be, Tisa, I can see your brain working. You're going to submit an email to. Will you please include that it has to be something that the CAAs can pull and not eLogic pulling for them?
No.
So that they can see it. Thank you.
You know how
so
it works.
A blanket report, Tisa, that's what we've been asking for, and Lawrence has been asking a lot larger than I am, and I agree with him. If we can all just can we pull it anytime, and they create that report that it's easy to find, we can push the button and find it. Does that make sense?
So like a module four. Okay. Carson, FCAA.
FCAA right here. This is Elaine Nye. I'm just on board with both of them. We've never been able to get clean reports from eLogic, so I'm very nervous about them pulling the reports, sending them to you, and me never seeing them. Absolutely not.
Just to clarify, the state will not be accepting any reports that eLogic submits on CAA behalf.
Okay, good. And that the eLogic's reports are being done like this. All of us are running them the same, or getting the same data. We are all different, but eLogic's is not my friend.
Elaine, and you're from FCAA?
Absolutely.
Oh, that's so interesting. I thought
12
Lily
years.
Go ahead. You're cutting off.
12 years, July 1st, FCAA, dealing with elogic and reports, and am not ever going as clean and well as they should. So I'm sorry, I might be turning red because of that. But I didn't want it just be Lawrence and Leslie always having to have our backs. So here I am having your back.
Thank you. I appreciate that.
And Tisa, this is Jenny with Nye County. I wanted to mention that we ran into a bit of an issue when we were pulling our Module 4 reports. We were working with Mark, and I will tell you, basically Irene Dunlap, who's actually out this week, she's the one that works directly with Mark. And they did talk last week and made sure that they were both basically clicking the same boxes. However, the information that was pulling up was different.
Mm-hmm.
So, you know, we went with what we pulled here on our end, but I just wanted to make everyone aware of that, and hopefully whatever the bug was, because I have no idea what, you know, that could have been, but hopefully that's going to get worked out. Because yes, obviously if you know, we're all pulling different information or the numbers aren't consistent with each other, then that probably isn't what the goal is.
Yeah, for sure. That's deeply concerning as you guys have submitted reports. I know that I spoke to Connie about this because I think it was Nye, and there was another CA that said the dates, I think it was Lion. And I spoke to eLogic, and they said the date range was wrong. The date range that they were pulling was different from the date range that I had asked you guys to pull.
But that was an original issue, yes. But like I said, when Irene was working directly with Mark over the phone, they ensured that they were both pulling the exact same date range, the exact same, you know, like I say, boxes and so forth to customize. And it was clear, honestly, that the information Mark did pull would not have been accurate for just CARES. And I'm sorry, I should have cleared that up for CARES specifically, because it showed a lot. Shoot, I want to say it showed maybe 237 you know, people assisted with, whereas we know we only had like 8 or 11. So
it was over-reporting?
Mark's report was definitely over-reporting. Absolutely.
Connie, I'm like having a meltdown inside my brain right now.
Well, the data is only as good as the data going in. So I'm curious how they received so many. I'd be curious to see if there was a flag, a CARES flag on it, a tag. It's hard to say with just one side of the conversation.
So that's been an issue all along, is how do we characterize and classify services for each different funding source? And because it's left up to the agencies, we could characterize the way that we provide service differently from what the other agencies provide. So our numbers are going to be off if they pull a report for a specific set of services that don't include our definitions. And this has always been an issue, because when eLogic generates a report, because they have such closeness with the database, they kind of pick and choose and assume what it is that they think that we want to run, but it may not be a report against the services that staff are using to track client performance. So we can end up with, just like what Jenny said, we could end up with our own reporting saying that we serviced 1,000 people, but eLogic only shows that we served 150. Depending on how they classify services and which services the report was run against.
Right. So with the one-to-one eLogic had with all of you, based on your FY21 caps, that, and I said on a lot of those calls, they were aligning how you define services in the back end, so that when they pull reports, you pull reports, it pulls reports exactly as you define services. Are you saying that's still an ongoing issue right now?
I'm saying it could potentially be an issue across all 12 agencies if they're running a general report for everyone.
Because everybody defines services.
Everybody's different.
Yeah, CSAs definition of services they provide is different. And that's you, then all of you have to be aware of that as I ask them for a canned report. It's not going to be, it's always going to be apples to oranges.
So as a future project, how do we make sure that the way that I envision this working is that community action provides service in a particular domain
Yes.
for a potential client? In making sure that we're tracking that information correctly within the database, whatever that service is defined as should be the same for everybody.
As long as I see what you mean, as long as, because then it would go up to that domain, right?
Correct.
So if you're providing services under education, it would all filter up to that domain.
Correct. And then that way we don't have this problem. Everybody's providing, it may not be the exact same service, but at least the terminology is the same so that you can correlate it with the NPI and be able to generate a consistent report.
So we have to probably take it one level up, that report. Does that make sense? This is good. Okay, this is good. Is everyone okay with that idea? Like, I'll explore it further with the logic. All you have to do is nod. Leslie, you want to say something?
Yeah, Tisa, I think this is the discussion we've been having for quite some time. If we can just define that amongst Nevada of how that should be entered in. And I realize that eLogic is saying no because we don't want to make it that pinpointed, but at the same time, that's the ultimate goal. The ultimate goal is to get the data that is equal, that is consistent. And so I think they're missing the boat by not just saying, and you and Connie saying, how do you want that data? And to make it a little bit more consistent so that we are doing an apples to apples approach. I think, again, they're trying to do more of a global approach. And when we start to narrow it, we need to make sure, and that training, and I hate to even just say this, but they're probably not the best trainers because they are those data folks. They do have some pretty good trainers though, and making sure that we're using those right trainers to help us decipher how to actually put that data in consistently amongst the agencies, I think is the only way to do that. But if you go a level up, I think that would be fine too. But I think at the end of the day, that's what we're missing.
Elaine, you want to say something? You hopped on.
I'm just shaking my head for you.
Okay, so this is good. So as I go to speak to Ben and Mark, are you guys okay if I tell them just to see what that report might look like, just almost like a mock report if we look at it domain wise? And then I can send it to the board meeting for next month's board meeting, and then we can all look at it. Okay, cool. All you'll have to do is just nod your head or say no, and I'll accept that. Okay.
I was just going to say, do it by pick a domain and then have them generate a list of services for each agency for that domain. Yep.
And then I'll put a date range too.
Mm-hmm. Like and then you'll see.
Oh, Mary Jane, I don't know what you did, but that was pretty cool. Okay, I want to move on. This is really great. Just because we still have a little bit left. The state plan, our FY22 state plan is due September 30th, I believe, Connie. But I have attached FY21 state plan to this email. And what Connie and I envision is that I will work on a draft, and I wish like your strategic planning, well, maybe I'll come off whatever you guys come out of your strategic plan. Lindsay, if you could even share like a draft version of it, and then I'll create the state plan, like almost like a wish list. And then in August, we're going to do an in-person meeting if possible, given the circumstances, so that we can take each look at the state plan and then just get your opinion, get your feedback. The plan will be sent to you, the draft version, before that meeting, obviously. How does that sound, guys?
That sounds good. I just want to remind you, our strategic planning training is in September, the 15th and the 16th.
That's what I was thinking.
Yeah.
But then everyone should have some ideas, like what they want to accomplish next year. And then we can feed that into the state plan. Okay. Connie, did you want to say anything before I move on?
No, we will all just that it will also be posted on our website for 30 days. But I do think that I think the due date is September 1st.
Oh my gosh. I need to start working on that right away then. As tears pool. Okay. CAPs. The email for your CAP plan has been sent out. It is due on August 20th. Based on your when you fill out all those tabs, I sit and I create the scope. So please be mindful. Like if I don't understand one of your goals or I'm forgetting the CAPs. Connie, jump in and help me.
No, that's okay. I just noticed the agenda has it a little, but we have it off. Number 5, FY22 should be community action plan.
Yes, not assessment plan.
Not the assessment. Yeah.
Sorry,
yeah.
that was fault. Please be mindful, like the more you can break down your goal and your outcomes, the easier it is for me to understand and create a scope for you guys. And the budget narrative and summary has been updated on the CAP. So you guys should be okay with that. Do we have any questions about that?
So Tisa, how do we've been struggling with this for a minute because of the nature of the pandemic and how it ebbs and flows.
Mm-hmm.
How specific do we need to be? Because I mean, it's just like yesterday, who knows what the county could have done in order to address this pandemic issue, the resurgence, so which would affect our planning.
Well, given the nature of the pandemic, I mean, you're like when you say how specific, like you have an idea of what your outcomes are, right? Like, would that change even with the pandemic? Would that alter?
If I kept it general enough, no. But the tactics that I use in order to achieve that may.
Adapt, right?
Might change. Yeah.
Market goal might change to it. Amen. Okay, so that's a good point.
As long as my input would be that you do want to allow for some flexibility. So you don't want to be so detailed that should you need to do a course correction in the middle of the year that we're unable to do that because the cap was so tight. However, you do want to make sure that you're including information that's detailed enough to be able to understand what it is your outcomes or how those outcomes tie to the activities that you're proposing.
So as long as I can keep my narrative in order, then I should be able to make this general enough to be understood.
Yeah.
Okay.
And you target, and keep in mind, like halfway in the year, depending on the situation change, and you want to change your scope, I'm not going to be like, no, like I'll definitely be like, yep, let's change given the situation and the justification. So for sure. That's a good question. Thank you. Does anyone else have any questions? Okay. The next item is org standards. So last year, with exception of one CAA, everyone managed to get their org standards done. I had to report out to OCS that we only had 11 org standards, and I'm hoping they're not going to come back and ask too much question. I did say it was due to the pandemic challenges. It's really important that this year all 12 CAAs get their org standards, because that also helps Lindsay and I set our training plan, and to kind of and to help you. Now, given the situation, I will provide, Connie and I, if you can justify it, we will provide exceptions for certain standards if it makes sense to us. But if it's the question of being trained up or finding some resources for you guys, we're not going to provide exceptions. We will if need be, but in general, we would like everyone to be able to achieve each of the standards. Is that okay? Is that too much, guys? Okay. All right. Oh, and that is due. Org standards will take place September to October. So it's the same template, the same thing. We send it out, and then Connie and I will pick up some standards, and then we will reach out to you for evidence showing that you have met those standards. So don't send us the evidence unless we ask you for them. And then the results, so we have a spreadsheet. I let you know each of your score, and then I'll share that with Lindsay, and that will inform our training plan. Okay, cool. Moving on. And all of this language just explains what I just said. Monitoring. So this is fun. All CAAs are due for monitoring. So that is going to happen. We have selected 5 agencies for this year that are just overdue. It will be a virtual monitoring. I will reach out to you with all the details on how it's going to look like, what type of information we need, and then give you a block of time for you guys to let me know what works for you guys. So I'm assuming it's not going to be stressful at all, but we shall see as we go forward. So 5 agencies this year will go through it. I don't really want to share which 5. I'd rather individually contact them and let them know.
This is Mary Jane. Will that include a fiscal monitoring as well, or fiscal audit? Okay.
It's what you expect for monitoring, like everything fiscal, programmatic.
Okay, I just have to let my fiscal team know. Thank you.
Yeah. If you have any questions, say now or hold your peace. Just joking. My corny jokes. Okay, Lindsay, this is with you. Training plan. Lindsay and I will base the training plan once your strategic plan is created, and then once the org standards are done for this year. We have identified some areas from last year's org standards that unfortunately were not met, but they will fit into our FY22 training plan. And that training plan will be shared with all of you guys in a draft version, and all of you guys can provide your feedback, maybe at a board meeting. That makes more sense. And then it will be finalized. Does that sound good, guys? Okay. And this is my favorite part, state communication. So guys, I need you to tell me if I am not communicating stuff that you want to know. I really need you guys to tell me so I can improve upon it. So and you don't have to talk about it now if you don't want to. You can email me. I have brought that up on our one-to-one, so I kind of know the feel of what's going on. But is there anything you want to say right now in terms of communication stuff that I'm not really fulfilling that needs to be fulfilled?
No, I think you're doing pretty good with us. I mean, we implemented that monthly. So, but have you received any feedback yet from the survey?
The ASIC, is that how you pronounce it? I did. And that kind of goes to, we scored pretty low, which I'm personally I was super shocked because I'm such a blah, 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 blah person. And I think I'm really like engaging and keep in touch, but I think we scored 63, which is average. And then I did look at the verbatim, and that's why like I really, if there are areas that needs to be improved in terms of the state communication, please let me know. I can improve what I don't know. So please, guys, because every year when I do the state plan, I'm like, our score is going to be 90. That's what I say. And then it's like 63 and I'm saddened. Lindsay, do you want to say something?
Can you explain the survey real quick?
Oh, yes.
Did it go out? Yeah.
It's a survey. I actually have the spreadsheet open right now. It's a survey. It's called, what is it called? American Customer Satisfaction Index, ACSI, AXI. I don't know how to pronounce that. But it goes out, I think, spring of every year to all the CAAs, and they have a list of questions on terms of how the state is doing. And the CAAs fill out that survey, and then, so it's a consultant for OCS, and they synthesize the data and send it out as reports to all states.
It helps inform, it assists us to inform how we improve the program at a state level. So it's valuable feedback, sincerely appreciated. Just want to make sure we're opening those lines of communication so that we can, in fact, improve Nevada.
And then Lindsay, NCAA receives a survey link too. So next year you'll receive it too.
Wonderful. Sounds good. Thank you.
So guys, next year I really want to score an 89. So please help me. Just let me know what I can do better and I'll do it. You guys know me by now, how type A I am. Okay, so we can move on from communication. You have nothing else. And we talked about XC survey and we talked about eLogic. Now it's like an open discussion. Is there anything you guys want to talk, or you guys want to, if you have any questions for Connie and I?
Yeah, eLogic.
Yes, Lauren. Talk about eLogic more, please.
All right, so we're gonna try and delve into this, what do they call it, the client portal thing?
Yes.
Is anybody else using that to great effect or no?
No, Leslie refuses.
No, I'm actually using it to a certain degree. But I'm not doing it across the agency. I like to take baby steps, Lawrence, and quite frankly, we don't use eLogic across the agency, as most don't anyway. I'm assuming I'm not alone in this. So we're trying it with our VOCA clients, and you know, I'll just leave it at that.
All right.
So Lawrence, a lot of my family resource centers, not a lot, a couple of them are using Client Portal. So I can kind of garner some feedback from them about how their experience is for you, if that works.
Okay. I'm just trying to get a handle on how best to implement, and then what kinds of response should I expect?
What do you mean? What kind of response should you expect?
Well, due to the pandemic, there's an increase in the number of clients who want to interact digitally. Okay. But if this isn't a smooth process for them, or if there's multiple hangups in going through the client portal, I'm not sure I want to take on that headache. I don't want to become IT for.
Right.
So maybe Tisa, maybe we can schedule a meeting with the FRCs that are using the client portal and invite any community action agencies that are interested in doing it, and have that conversation so it's very transparent.
That's actually a good idea. I'd like that.
Because then too, maybe there's some lessons learned from them that would that we could glean.
And then Lawrence, I wanted to say a couple of months ago, James and I sat down and we actually did a client portal. So James created like a mock account and we both sat down and accessed it as a client, as a new client, and as somebody on the admin side. And we had a list of feedback, and you were on that call with eLogic, remember? We were like, this is really wonky. This makes no sense. So go ahead.
Yeah, I wasn't sure if we got any response back from that.
They said they were going to work on all of those, but
right.
that is something I will follow up with, and I'll find that email.
Well, and maybe James has a follow-up. I mean, it seems like there's several people that were involved in it.
Yeah, there was a little bit of feedback, but nothing consistent. And then we never had another review, another demo to see what the changes look like.
For some reason, Lawrence, you thought he wasn't even the feature wasn't live right now, which was kind of surprising to me. Yeah.
Well, that's how little feedback we got. So.
And they just sent out, eLogic just sent an email soliciting feedback on Client Portal.
Yeah, and there's supposed to be a training.
On the Client Portal again?
Mm-hmm.
That's interesting. Okay, so then the other thing I wanted to say, Connie and I are, and this was raised from my FRC, creating a consent form for Client Portal. And that's only if the agency wants to use it for themselves. But the state will create a consent form. We will have to have our DAG, our Deputy Attorney General, review that consent form before we can release it to you guys. So keep that in your back pocket, Lawrence, if you wanted to use that consent form.
Okay, no, that's good, and leads me to something else.
Oh my gosh, Lawrence, you're killing me today. Go ahead.
All right, so on each of the budget spreadsheets, there's a clause for notification to GMU for any events that we may have as it relates to COVID preparedness. Is there a particular
that's still on the template?
Yeah, it's there.
On the budget narrative that I sent out?
Yep.
Okay.
As part of
That's
the
our error. Damn it. That means it's everywhere.
Oh, oh, I see what you mean. Like the little the COVID-19 pandemic
Right.
language.
Right.
Yeah. So what you're gonna see, we'll send you everyone a new template. Or if you want to take the template you have and erase that second sentence, what it should only say is your activities need to comply with state and local requirements. That first sentence, the second sentence should have been deleted.
Oh, for the large events. Okay.
Yes.
Okay.
So take out that COVID language because it doesn't pertain anymore.
No, that should have been removed from our templates. My apologies.
Sorry. Is that okay? Like, as you guys each work on the cap, are you okay with removing that COVID language?
We will send an additional, we're going to send an additional template just so you have it clean. But if I know for you guys have had it for a little while, so if anyone has started the process, please feel free to just delete that line. That's all we're going to do. That'll be the only difference.
Okay.
Chief Notes, Jenny again. I just wanted to ask, looking at the cap that was sent out most recently, and Connie, I do hear you that a new one should be coming out. Just wondering if anybody had had a chance to look at the formatting. I know that we had talked about that at that last meeting we had 1-to-1. From what I'm seeing, it still it is fine. If I need to go through and reformat those pages to make sure that they print clearly and all that good stuff, I can do that. But if by chance that might be something someone would take a look at, that would be great too. So maybe just let me know.
Formatting, this is the latest version of our budget narrative that Catherine and Cindy worked on.
Okay, and specifically, I'm talking about the other tabs in there. Let's see here, planned use of CSBG funds, everything past the narrative and the summary sheet.
What's wrong with the formatting is not?
To go, when you want to go print, for instance, planned use of CSBG funds, it's going to print on 4 pages. Last year when we had worked on our, application, like I said, I had gone through all those tabs and I did reformat them so that we could at least print them clearly on our end for our records. But like I say, the way they stand now, they're just
printing.
Lisa, do you know what she means? So we would go to each tab and change the margins and the way that it prints. So we want it to print 1 page across, and then it can be, open to the bottom page. We just need to change.
I'm gonna ask Cindy for that because I have no idea how to be that techie.
If you send me the cap, the current cap, I will update it.
Okay, so you guys are gonna get a new cap in one email because the cap is the same for everyone. Okay, so don't work on it. That's my last statement on that.
Unless you know how to change your margins and can format. That's completely at your discretion.
But that will be sent out tomorrow.
I thought we were told we couldn't change it, but that's just me. I got slapped on the hand for changing that formatting.
Who slapped you? Okay, you don't have to say who. Wasn't me. Just kidding. Probably was Leslie. Okay, guys, we're like 11:10. Do you guys have any other questions, feedback, comments, and even people on the phone? Because you guys are so quiet.
Is anybody going to NCAP?
Yes, almost everyone. Carla.
Yeah, I think we have 15 people going in person and 4 virtual.
Eric, Janine, Carla, Shayla, are you guys good?
This is Janine. Yes, we're good. And Elaine and I will be at NCAP. Not in person, but virtually.
Oh, cool. I'm excited to meet all of you in person in Boston. And I'm a hugger, so I'll be hugging all of you guys. Well, thank you so much, guys. If you have no more questions, I'll end it here. Thank you so much for attending. And then in the next 4 months, we'll do another meeting just to go over other good stuff. So thank you. Have a good day.
All right.
Thank
care,
you.
everybody.
Have a good day.
Bye.
Bye. Bye.